Welcome back, everybody, to another deep dive. Today, we're going to be talking about MUO,
Oh, yeah.
which is something that I think a lot of our listeners are probably familiar with.
Right.
But we're going to be looking at it in a slightly different way than maybe we have in the past.
Absolutely.
So this is going to be exciting.
Yeah, this is a fun one. So we're talking about a paper that looked at MRI features of dogs with MUO and how those features can be prognostic for survival time.
Right. And I think this is something that, especially for general practitioners who don't, maybe deal with neurology as often as you do.
Sure.
It can be really helpful to be able to look at an MRI and say, okay, well,
Yeah.
based on what we're seeing here,
Exactly.
you can tell the owner,
Yeah.
what the likely outcome is.
This is going to help you make decisions about treatment, and you know how aggressive you want to be with treatment, or maybe this is a patient that we say,
Right.
you know what, this isn't a great idea.
Exactly.
Yeah.
So the paper that we're looking at is titled Magnetic Resonance Imaging Prognostic Factors for Survival and Relapse in Dogs with Meningoencephalitis of Unknown Origin. And it's published in Frontiers in Veterinary Science.
That's right.
And I think it's a really well-written paper.
It is.
And there's a lot of great information in it.
Absolutely. And it was a retrospective study that took dogs from 2016 to 2022
Okay.
at two institutions, the University of Liverpool and the Royal Veterinary College.
Got it. So just to start off, I think maybe a good place to begin would be just a really brief, refresher on MUO. I mean, we've talked about it on the deep dive before, but
Sure.
for those who are maybe tuning in for the first time or just need a little reminder, what is MUO?
Right. So MUO, meningoencephalitis of unknown origin, really just means inflammation in the brain and the meninges. And the key word there is unknown. It's
Yeah.
a diagnosis of exclusion. We do a bunch of tests to rule out things like infections or cancer or metabolic disease. And once we've ruled out everything that we can think of, then we're left with this diagnosis of MUO.
So it's really almost like a
Yeah.
catch-all term.
It is. It's a wastebasket term.
Right.
Yeah.
When we don't know
Yeah.
what else to call it.
Absolutely.
And it's interesting, we've talked about this in the past about how even with histopathology,
Right.
sometimes it can be hard to differentiate between the different subtypes of MUO.
Absolutely.
Like GME and NME and NLE.
Yeah. So we can look at it under the microscope and still not know.
Right.
For sure.
And so that's why I think this paper is really interesting, because it's trying to find other ways to
Yeah.
kind of predict
Here.
how these patients are going to do.
Absolutely.
So, MRI is obviously a very important tool in neurology.
Right.
Can you maybe talk a little bit about why that is?
So MRI is great because it allows us to look for structural abnormalities in the brain.
Okay.
So things like lesions or masses or, any kind of change in the structure of the brain.
And that's really important for MUO because those lesions that we're talking about are those areas of inflammation.
That's right.
Right.
That's right.
So that's what the MRI is allowing us to see.
Absolutely. And not only can we see them on MRI, but we can look at different features of those lesions.
Right.
Like, are they bright? Are they dark? Are they surrounding a vessel? Are they contrast enhancing? And all of those things can help us to figure out,
Yeah.
maybe what type of MUO we're dealing with or what the prognosis might be.
And that's really what this paper is getting at, is
Yeah.
looking at those different features
Absolutely.
and trying to figure out, what do they tell us about how this dog is going to do?
Exactly. So they were really looking at two things.
Right.
Survival time.
Okay.
So how long dogs live after diagnosis
Got it.
and relapse. So do they have a recurrence of their neurologic signs?
Right. And they looked at 138 dogs
That's right.
for this study. And like you said, it was retrospective.
Yeah.
So they were just looking back at, medical records and,
Yeah.
and seeing what patterns they could find.
Exactly.
So what were some of the things that they found?
So the first one is a term called T2 lesion load.
Okay.
And all that means is the volume of the lesions that we can see on a T2 weighted image.
So you can actually measure
We can measure it.
the size of those lesions.
We can.
Okay.
That's exactly right.
And they found that dogs with a lower T2 lesion load were more likely to survive for at least a year.
They were.
Okay. So that's really interesting, because it's kind of counterintuitive, you would think that.
You would.
The more lesions, the worse the prognosis.
You would think so. But in this case, they actually found that the opposite.
So maybe it's not just about the number of lesions, but also about
Yeah.
the location or the size or other factors that we're not.
Absolutely. There are so many things that we don't know.
Right.
about these diseases.
Yeah,
And
that makes a lot of sense.
So yeah, it's not as simple as just looking at the number of lesions. We have to look at the whole picture,
Right.
the whole patient.
Yeah, and I think that's something that's really important to remember is that, these are just statistical associations.
Absolutely.
This doesn't mean that every dog with a low T2 lesion load is going to do well.
Right.
And every dog with a high T2 lesion load is going to,
Yeah. Right.
not do well. It's
just a piece of the puzzle.
Well,
It's something to consider.
Yeah, a piece of the puzzle.
Yeah.
So that was one of the major findings that they had. And what was the other one that you mentioned?
The other one has to do with contrast enhancement.
Okay.
So sometimes when we do an MRI, we inject a contrast agent.
Yeah.
And that contrast agent helps to highlight areas of inflammation.
So basically, if there's breakdown of the blood-brain barrier,
Right.
the contrast is going to leak through
Exactly.
and show up as bright on the MRI.
All right.
So what they were looking at in this paper is they called it T1 post-contrast lesion load.
Mm-hmm.
And so basically,
wow.
how much contrast enhancement is there?
That's right.
Yeah.
How much are the lesions lighting up?
Right. So that's interesting because you would think,
Right.
again,
You would think.
more contrast enhancement means
Yeah, more inflammation.
more inflammation,
Okay, yeah.
worse prognosis.
Right. You think so?
But what did they find?
They actually found that dogs with a higher T1 post-contrast lesion load were more likely to relapse.
Wow.
Yeah.
So that is really
Surprising.
counterintuitive.
It is.
Because again, we think more inflammation, worse prognosis.
Right.
But in this case, more contrast enhancement.
More contrast
More
enhancement.
likely to relapse.
Yeah. Which seems like a worse prognosis.
Yeah. So how do we explain that?
That's the million-dollar question, isn't it?
Yeah, that's the million-dollar question.
So it could be that the T1 post-contrast lesion load is a better indicator of active inflammation. So maybe those dogs are just having a more exuberant inflammatory response.
Got it.
They're more likely to have a flare-up
Makes sense.
later on.
So we have these two key findings.
Yes.
Lower T2 lesion load, better survival.
Right.
Higher T1 post-contrast lesion load,
Uh-huh.
more likely to relapse.
Yes.
Did they find anything else interesting when they were looking at these MRIs?
They did. They also looked at the location of the lesions.
Okay.
And they found that the most commonly affected areas were the white matter tracts,
Okay.
specifically the corona radiata and the corpus callosum.
Which makes sense because those are big communication pathways.
That's right. It's like the highway system of the brain.
Right.
So if you have inflammation in those areas, it's going to disrupt communication between different parts of the brain.
And that can lead to...
And that can lead to all sorts of neurologic signs.
Right. And they also found lesions in the...
They did. In the cortex and the frontal lobes, the sensoromotor cortex, and the temporal lobes.
Okay. So those are areas that are responsible for...
For really important things like planning and movement and sensory processing and memory.
Wow. So it really is like a wide variety of brain functions.
Absolutely.
Yeah. It's not just like one...
Right.
specific...
It's not just one thing. It can affect a lot of different areas.
So that's really interesting. And then in addition to the MRI findings, they also looked at...
They did.
The neurological function of the dogs?
That's right. Using a tool called the Neurodisability Scale, or NDS.
Okay. And what is that?
The NDS is basically a way to score the severity of a dog's neurologic signs.
So the higher the score?
The more severe the signs.
Got it.
So a dog that can't walk at all would have a higher NDS score than a dog that's just a little bit wobbly.
Got it.
And what they found was that higher NDS scores were correlated with higher lesion loads on MRI.
So again, more severe neurological signs.
More severe neurologic signs.
More extensive brain involvement.
More lesions on MRI.
Yeah. So all of this is starting to paint a picture of, how these different factors are all interrelated.
Exactly.
But I think the big question is, so what?
Yeah.
What does all this mean?
So what? What do we do with this information?
For vets, for owners, for the dogs themselves.
That is the million-dollar question.
Yeah. So that's what we're going to talk about.
That's right.
When we come back.
After the break.
After the break.
To part two.
In part two.
All right, so let's talk about the so what of this whole thing.
Yeah, I mean, we've gone through all of these findings.
Yeah.
What do we actually do with this?
Right. How do we apply it?
Yeah.
To real-life patients.
So for veterinarians out there who are seeing these MUO cases,
right.
What are some of the ways that this information could be helpful?
So I think the biggest thing is that it can help us to make more informed treatment decisions.
Okay.
So like we talked about before, a lower T2 lesion load is associated with better survival. So if we have a dog that comes in and they have a relatively low T2 lesion load, we might be a little bit more conservative with our treatment.
Okay, so you might not.
I might not jump to the most aggressive treatment right away.
Yeah.
We might start with something a little bit more mild and see how they do.
Especially if they're maybe an older dog or...
Exactly, or if they have other health problems.
Right.
That might make them more sensitive to the side effects of some of the medications that we use.
So it's really about individualizing.
It is.
Treatment.
It's about tailoring the treatment to the individual patient.
Not just saying, okay, every MUO gets this protocol.
Exactly.
We need to look at
the whole picture.
the whole picture.
The patient's signalment, their clinical signs, their MRI findings, and then we can come up with a treatment plan that's best for that individual.
So on the flip side, we talked about how a higher T1 post-contrast lesion load is associated with a higher risk of relapse.
That's right.
So in that case, might we be more inclined to...
We might be more aggressive with treatment.
Yeah. Okay.
If we see a dog that has a lot of contrast enhancement on their MRI, we might say, you know what, this dog's at a higher risk of relapsing.
Right.
So we're going to start them on a more aggressive treatment protocol from the get-go.
So it's really about trying to prevent that relapse from happening.
Exactly. We want to try to get ahead of the disease.
Right.
And hopefully prevent those neurologic signs from coming back.
And so I guess the question then is, how do we explain this to owners?
Right, because this is all very technical information.
Yeah.
And it can be hard to explain it in a way that makes sense.
I think this is where, communication is so important.
It is, absolutely.
Because you don't want to just throw a bunch of jargon at them
and
expect them to understand.
Exactly. We need to explain it in a way that they can understand and that they can use to make decisions about their pet's care.
And I think it's important to emphasize that even though these MRI findings are helpful, they're not
perfect.
Right. They're not crystal balls.
Right.
We can't say with 100% certainty what's going to happen.
Right.
We can't predict the future.
But it does give us, it gives us more information.
Yeah. More data points to work with.
Absolutely.
And I think that can be really helpful.
It can, for both the veterinarian and the owner.
For everyone involved.
Absolutely.
Okay, so we've talked about how these findings can help us to make treatment decisions.
Yes.
But I'm also curious about, the fact that T2 lesion load and T1 post-contrast lesion load seem to be telling us different things about the prognosis.
Right. They're giving us different information.
So what does that mean? Why are these two things behaving differently?
That's a great question.
Yeah.
And I think it really highlights the complexity of MUO.
Yeah.
Remember, MUO is not one disease.
Right.
It's an umbrella term.
Yeah. We talked about that at the beginning.
So it's likely that there are different subtypes of MUO, and those different subtypes might have different underlying causes.
So it's not just inflammation.
It's not just inflammation. It's what's causing the inflammation.
Right. And why some dogs might respond to treatment better than others.
Exactly.
Or why some dogs might be more likely to relapse.
And maybe those different subtypes are reflected in the different MRI findings.
Okay.
So maybe dogs with a high T2 lesion load have one type of MUO.
Okay.
And dogs with a high T1 post-contrast lesion load have a different type.
So even though they might present similarly.
Exactly.
Okay.
They might look the same on a neurological exam.
Right.
But their MRIs are telling us something different.
So it's really about looking beyond.
Looking beyond the surface, looking at the detail.
The details.
And trying to figure out what those details are telling us.
So I guess the million-dollar question then is,
right.
Can we use this information to develop better treatments?
That is the million-dollar question.
Yeah.
And that's what researchers are working on right now.
So we're not quite there yet.
Not yet. But we're getting closer.
But this is a really important step.
It is.
In that direction.
Absolutely.
So it sounds like there's still a lot that we don't know about MUO.
There is.
But we are learning more.
We are. We're making progress.
And that's exciting.
It is very exciting.
So what are some of the things that researchers are looking at right now?
To try to better understand this disease.
Yeah. What are some of the hot topics in MUO research?
So one of the big areas of interest is the immune system.
Okay.
Because we know that the immune system plays a role in MUO.
Right. I mean, that's why we use...
Exactly. That's why we use immunosuppressive drugs to treat it.
Immunosuppressive medications.
But we don't really know exactly how the immune system is involved.
So is it an autoimmune disease?
Right. Is it a case of the immune system attacking the brain?
Or is it something else?
Or is it something else entirely?
That's the burning question.
That's the question that everybody wants to know the answer to.
And I guess part of that is trying to figure out...
What triggers the immune system in the first place?
Yeah. Why does this happen? Why does some dogs get MUO and other dogs don't?
Right.
And I know that there's been some research looking at
The microbiome.
yeah, the gut microbiome.
The gut microbiome.
Which is fascinating.
It is.
To think that, what's going on in our gut could actually be influencing what's going on in our brain.
It's wild.
It is.
But there's growing evidence that the microbiome plays a role in all sorts of diseases.
So it's not just, gut health.
It's not just gut health. It's brain health. It's
Yeah.
immune health. It's everything.
It's all connected.
It's all connected.
So this is really a new frontier, I think,
It is. It's the wild west of research.
in veterinary medicine.
Absolutely.
So we've talked about the potential implications of this research for diagnosis and treatment.
Uh-huh.
We've talked about some of the big questions that researchers are trying to answer.
Mhm.
But let's shift gears for a minute and talk about what this all means for the dogs themselves and the people who care for them.
Yeah. Because at the end of the day, that's what really matters.
Exactly. So what can owners do
Right.
to help their dogs?
If they're diagnosed with MUO, I think the most important thing is to work closely with their veterinarian.
Yeah.
MUO is a serious condition.
Right.
It requires prompt and appropriate medical management.
So no Dr. Google?
No Dr. Google,
Right.
no trying to treat this at home.
Right.
It's really important to get veterinary care as soon as possible.
And I think, one of the things that's really challenging about MUO is
Yeah.
that there's not a one-size-fits-all approach to treatment.
Absolutely.
Every dog is different.
Every dog is an individual.
And so what might work for one dog might not work for another.
Exactly. And that's why it's so important to work with a veterinarian who can really tailor the treatment plan to that individual patient.
So working with the vet,
Uh-huh.
following their instructions,
Yeah.
not delaying treatment, all super important.
Okay.
What else can owners do?
Once their dog has been diagnosed.
Yeah. I mean, besides the medical management,
Right.
what are some things that owners can do at home too?
So I think one of the most important things is to provide a loving and supportive environment.
Oh,
These dogs are going through a lot.
right. They're not feeling well.
They're not feeling well. They're probably scared.
Yeah.
They're confused.
They might be having neurological signs that are really
Absolutely.
bizarre and scary for them.
So anything that we can do to make them feel more comfortable and secure is going to be helpful.
So I guess that means things like
Yeah,
sticking to a regular routine,
absolutely.
feeding them at the same time every day,
Uh-huh.
making sure they have a comfortable place to sleep,
Yes,
minimizing stress in the home.
exactly.
Yeah.
And lots of TLC,
Of course.
lots of love and attention.
I think that's always good medicine,
It is.
no matter what the condition is.
Absolutely.
But are there things that owners can do
Yeah.
to specifically help manage,
The neurologic signs.
like if a dog is having seizures or
Yeah.
if they're weak or they're having trouble walking?
So there are definitely things that we can do. So for example, if a dog is having seizures,
Yeah.
there are medications that we can use to help control those.
Right.
If a dog is weak or having trouble walking, physical therapy can be really helpful
Okay.
to help them regain strength and coordination.
So it's really a multimodal approach.
It is.
It's not just about medication.
It's about looking at the whole patient and addressing all of their needs.
And I think it's also important to remember that, MUO is a challenging disease
It is.
for both the dog and the owner.
Absolutely.
And so it's really important.
Support the owners as well.
Yeah. Because they're the ones
They are.
who are providing the day-to-day care.
That's right.
They're the ones who are
Yeah.
seeing their dog go through this.
And they're the ones who are making the tough decisions
Right.
about treatment and about quality of life.
And so it's really important for veterinarians to be compassionate and understanding and to provide the support that those owners need.
It's a partnership
Yeah.
between the veterinarian, the owner, and the dog.
I love that.
Mm-hmm.
And I think that's something that's really important
Yeah.
to keep in mind.
In veterinary medicine in general, it's
Yeah.
not just about treating the disease.
Right.
It's about caring for the whole patient
And the family.
and the family.
So as we wrap up this deep dive, I think it's clear that MUO is a complex and challenging disease,
It is.
but we are learning more about it all the time.
We're making progress.
And research, like this study that we've been discussing,
Right.
is really helping us to move in the right direction.
Absolutely.
So for all of you out there who are dealing with MUO in your own dogs,
Yeah.
know that you're not alone.
You're not.
There are people out there who are working hard to find better treatments.
And better ways to manage this disease.
And there is hope.
There is. From Vet NeuroJar. Keep those minds-inspired hearts light and tails wagging.